bonjour, bienvenue. Donc, nous avons eu la chance cette année d'avoir le professeur Berry comme conférencier invité en séance plénière. Dr. Berry, hello, and could you please introduce yourself to our French colleagues?
Thank you, Moussa. My name's Daniel Berry. I work at the Mayo Clinic. I'm a hip and knee arthroplasty surgeon there, and I'm having the privilege of being at Sofcot this year.
Okay, and where do you come from exactly? What has been your career? Can you tell us a little about this?
Sure. I did my training in orthopedic surgery in Boston at Harvard, and then I did a fellowship at the Mayo Clinic. And after that, I was in Europe for 6 months, with mainly with Maurice Muller, but also with Emile Letournel here in Paris. Then I went back to the Mayo Clinic, and I've been at the Mayo Clinic ever since.
Dan, we are here at our national meeting. There are a lot of young and more experienced surgeons listening to us. At your stage, what would be the advice you give to a young guy? He's finishing his residency, he wants to move back in orthopedic surgery. What would be your advice?
Well, of course, there's a lot of different things to consider at that stage in your career. But one of the main things I would say is choose a topic or an area of interest that you, number one, care about, and number two, that you think has unsolved problems. Problems that you can make a difference over the course of your career and working on. Number two, stay engaged with your orthopedic community. There's lots of ways to do that, but do it both at your job and do it at a national level. In your subspecialty, yes, but also collectively in your entire profession. That's why I think a meeting like Sofcot is so good. It gives you a chance to, number one, interface with colleagues, but number two, to learn what's going on in fields outside of your own. And lastly, by participating in a big group organization like Sofcot, you give voice to yourself as a profession in a way that you can't do in an individual manner.
Okay, I know you had many commitments, president of the Academy, president of the ACUS.
Yep.
I think you're now president of the International Hip Society.
Just finished.
Can you explain to us what is this society?
Yeah, the International Hip Society is a group of roughly 100 surgeons from around the world. Each person is handpicked for their special expertise and knowledge and contributions in hip surgery. We get together 2 out of 3 years to discuss papers. We publish many of the papers. And it's an opportunity for surgeons to get ideas from around the world, bounce them off one another, try to learn from each other, and hopefully move the science of hip arthroplasty and other hip surgery forward.
Dan, I had the opportunity to send a few of my junior partners to your place, thanks to you, to Mayo Clinic. How could you define Mayo Clinic in the orthopedic world compared to what is existing around the world?
Well, there's many great orthopedic centers around the world. I think the Mayo Clinic's lucky to be a part of those good centers. It's a center that's a little bit unique because Mayo Clinic is a hospital that involves all types of both medicine as well as surgery. So it's a multi-specialty hospital. Orthopedics is an important part of it, but by no means the only part of it. One of the defining parts of the Mayo Clinic is that it's a very well-resourced place. There's a lot of opportunities there. And the colleagues there all get along very well, so it's a very collegial place to work. And that's, I think, one of the reasons why we've been successful in terms of our interactions with one another, but also with some of the bright young folks that you've sent us. They've had good experiences there, I think, and they've come back to be leaders in Europe, which we're very proud of.
Okay, 2 very short questions. What was your preferred surgical procedure, and what was your most hated surgical procedure? The one you preferred, the one you didn't like to perform. Quickly.
Okay, well, my most preferred one, I think I have to say, is hip arthroplasty, because hip arthroplasty is just such a game-changing, pleasing procedure for patients. No question about it. The most hated procedure. I hated taking care of problems related to failures of my own, whatever they were. Whenever something failed, it tore me apart.
But I know you did. Yeah, I know you did yourself.
It tore me apart. So I hate those. But you have to do it and do a good job of it, by the way. If having the problem is not the problem, not fixing the problem well is the problem.
Dan, when you are not doing orthopedics, what are you doing outside of the hospital world?
Yeah, I'm an outdoor guy, so I enjoy hiking in the summer and backpacking. I enjoy fly fishing. I'm a skier, both cross-country and as well as alpine skiing. And I'm lucky to have 2 kids, and I like to spend time with them as well.
Okay, thank you very much, Dr. Berry. Thank you to come to us, and it's always a great pleasure to see you. Thank you very much.
Merci.
Merci, Moussa et Jean-Noël.